Welcome to another episode of Medtech Byte. In this episode, we have a very interesting topic to discuss. With the booming industry of healthcare, with the kind of need that we have in healthcare industry right now, this particular department or this particular topic in healthcare industry needs a lot of attention. Yes, I'm talking about sterilization. I'm talking about disinfection, which is very important for patient safety, which is very important for a hospital to provide as a service to any patient. To discuss about this topic and to know more about it, today we have among us Ms. Mukta Kuyare, the Manager CSSD and Paramedical Services at Bhaktivedanta Hospital and Research Institute, Mumbai. Welcome to the episode, Mukta ji.
Thank you, Rimi madam.
So yes, we would like to know now, if you can just enlighten us on the topic CSSD. What is CSSD and what is sterilization?
So imagine you are going for a surgery in a hospital. Whom do you see after your surgery is done? You see a doctor, you see a nurse, you see a housekeeping staff, right? And in fact, you see a lab technician also. But have you ever wondered what happens to your instruments which are used on you? Right? So who are the people who are cleaning them? How they have been reused? There comes the people who are called as Central Sterile Service Department technicians. This is a very important department and we address it as heart of the hospital. What happens in this department is we have instruments which are cleaned, reprocessed, packed, checked and then supplied to the user department. Nowadays, with the robotic surgeries coming into picture, all these complicated surgeries are cleaned, properly checked and then reassembled. Here we have a quality indicators where we need to tell them that whatever you are giving it to the user department is actually sterile. So a lot of chemical indicators are also used. Next, here we have a linen and a dressing material packing area. Further to that, all the instruments after sterilizations are kept into a area which is under a particular temperature and a humidity conditions. The area or the temperature is maintained which is similar to the OT. So here the instruments are kept and then supplied as per the need to the user department. So we have come across a platform which is called as Academy of Sterilization Technologies. This is an institute where right from ABCD of instrument cleaning will be taught to all the students. What instruments we are using on patient, that will also be taught to all the students. So I think AST is a forum or a platform where even a peer person who doesn't know anything, he may come across from any kind of a background, either from a science, commerce, arts. Here he will get all the knowledge.
So you got to know why AST has come and what made AST to be formed. You got to know what is CSSD and what is the need right now Indian healthcare sector has. And now we will get to know how this AST as a platform came into existence.
So before telling the story about AST, I introduced myself.
Yes.
I put in 34 years service in the army and after retirement, I joined an spine and orthopedic hospital in Delhi. My tenure was as a HOD CSSD. There I realized that CSSD is one of the most crucial department in any hospital. It decontaminate, disinfect, sterilize medical instruments, medical devices and equipments. That is very important. Otherwise, if there is any lacuna, patient will have hospital-acquired infections. So that is why it is called heart of the hospital. But we also realize that very less formal education is available in our country for these professionals who reprocess these articles. Most of the CSSD professionals enrolled in hospitals, we found that they have the diploma of OT technicians, not CSSD diploma. So to fill this gap, we formed an association that is called Indian Sterilization Healthcare Association, Isha. And we started doing conferences, workshops, seminars. And in the series, we used to organize one big conference every year. We used to say that ISHACon. Recently, we organized 7th ISHACon at Delhi Chamber of Commerce, New Delhi on 30th March, in which Dr. Jitendra Sharma, MD of Amtz, he was there as a chief guest and he stood for helping us. He invited us to come to the Amtz. We reached here on 19th April and there was the AST born. And now we have planned many courses to be run by the AST so that this gap can be filled, formal education can be provided to the CSSD professionals or anyone who is interested for this. So currently we have started diploma in sterilization technologies and other 2 courses are in the pipeline, PG certificate in sterilization technologies and BSc in technologies, but these courses will also run in coming days. And just we have come here at Amtz. So we welcome all those who are interested in getting formal education for CSSD. They can enroll themselves and they will have a very bright future in the coming days. Thank you so much for the Dr. Jitendra Sharma also.
Of course.
He invited us and he is behind the scene to create this organization.
Yes.
Thank you so much and thanks to the Amtz also.
Yes, so nothing goes, without thanking Dr. Jitendra Sharma, because every vision, every idea,
True.
every movement that you see in healthcare that is happening from Amtz is all a brainchild of Dr. Jitendra Sharma.
It was our dream also. It is mentioned in our vision and mission also. In 2018, Isha was registered. At that time, we had laid down the vision and mission to have some college, some research facilities. But we could not, we were not, because due to lack of opportunities and many things required for that. Dr. Sharma is realizing our dreams come true.
So once the
Thanks
intention is put, it definitely gets manifested. So yes, those enthusiasts for sterilization, those who are interested in sterilization in hospital can definitely look into the website. Thank you so much. Thank you once again.